Renal nutcracker syndrome is when the left renal vein, which drains blood from the left kidney, gets squeezed between two arteries, the superior mesenteric artery and the abdominal aorta. It's kind of like the renal vein is the nut and the two arteries are the nutcracker. Now, blood heading toward the lower body exits the left ventricle, swoops around the aortic arch, and then flows downward through the descending aorta, which is a large muscular blood vessel about as thick as a thumb. The descending aorta runs along the back of the abdominal wall next to the spine, where it's called the abdominal aorta, until it splits into the common iliac arteries. The abdominal aorta gives rise to a lot of smaller arteries, including 3 unpaired arteries, the celiac artery, the superior mesenteric artery, and the inferior mesenteric artery, all 3 of which branch off the anterior wall and supply blood to the digestive tract. It turns out that the renal vein, which carries blood returning from the kidney to the heart, passes right between the aorta and the superior mesenteric artery. The angle formed between these two vessels is called the aortomesenteric angle, and it's usually around 45 degrees, with the renal vein being cushioned a bit by fat in the mesentery. If that aortomesenteric angle is reduced, the arteries start to pinch the left renal vein like a nutcracker, preventing blood from getting back to the heart. This leads to a backup of blood in the left kidney and renal hypertension. Over time, the high pressures can cause small breaks in the renal blood vessels, and a tiny bit of blood can even get in the urine. Also, the left testicular vein drains into the left renal vein, so in men, blood ends up backing up into the left testicle as well. In young people, reduction of the aortomesenteric angle can happen due to normal growth, as well as changes in body proportions. As a result, sometimes the angle can widen just as easily as it narrowed. In adults, the most common cause is extreme weight loss as a result of severe or prolonged illness, like cancer, HIV and AIDS, drug use, and anorexia nervosa. Regardless of the cause, nutcracker syndrome typically results in left flank pain and hematuria, or blood in the urine. The backup of blood on the left side can also cause a varicocele in men, which is engorgement of the testicular veins, in this case the left testicular veins. Nutcracker syndrome can be diagnosed by imaging the left renal vein, with something like ultrasound, and then measuring the blood flow and the aortomesenteric angle, which can get as narrow as 6 degrees. The main treatment for this is simply weight gain, because when the mesenteric fat pad gets fatter, it widens the aortomesenteric angle, relieving the left renal vein compression. In severe situations where gaining weight doesn't do the trick, surgery might be needed to place a stent within the vein to keep it open. Alright, as a quick recap, nutcracker syndrome is when the left renal vein is squeezed between the superior mesenteric artery and the aorta, because that aortomesenteric angle gets too narrow. This causes increased pressure in the left renal vein, which can lead to hematuria and flank pain, as well as a left-sided varicocele in men. Nutcracker syndrome can be corrected with weight gain, and sometimes, if necessary, surgery.
Helping current and future clinicians focus, learn, retain, and thrive. Learn more